I wanted to welcome and thank everyone for being part of this first ever joint alumni networking event for University Liggett School, the Roper School, Detroit Country Day School, and Cranbrook Schools. On behalf of all the schools involved, we are excited to offer our community new and impactful alumni programming. And tonight we are bringing together alumni from across the medical industry to connect, share advice, and provide guidance to others looking to or currently studying medicine, as well as those who are in the early stages of their career. Tonight, we will hear from alumni panelists representing each of the independent schools earlier mentioned, as well as our moderator for this evening, Dr. Herman Gray, current chair of the Wayne State University Department of Pediatrics. I'd like to take a moment to introduce him tonight. Dr. Gray is a former president and chief executive officer of the DMC Children's Hospital of Michigan. Dr. Gray's history with Children's Hospital of Michigan dates to the late 1970s when he served as chief pediatric resident. While with CHM, he also served as vice president of graduate medical education, pediatric residency program director, chief of staff, and chief operating officer. He was named president and chief executive officer in 2005. He left in September of 2015 to become president and chief executive officer of United Way for Southeastern Michigan. Dr. Gray received his medical degree from the University of Michigan in '76 and a master's of business administration degree from the University of Tennessee in 2003. He is a fellow of the American Academy of Pediatrics. A child and family advocate, Dr. Gray has been honored numerous times for his humanitarian efforts related to pediatric healthcare. With that, I would like to turn it over to him to introduce our panelists and lead us tonight in what is sure to be an excellent discussion. Please join me in welcoming Dr. Gray.
Thank you, Mackenzie. I thought I told you to not mention the dates. It's good to see you all. Welcome. Thank you for being here. I'm delighted to play a small part in this. I suppose it's probably not hyperbole to say it's a historic event of these four incredible schools working together on a common cause. But whether it's historic or not, I'm delighted to be here and to be part of it in a small way. We have assembled a really extraordinary panel that represents graduates of each one of the schools, and all of whom have really pretty remarkable careers in and of themselves, and they're just getting started. And so I am, I have been warned, and anybody that actually knows my wife will understand this, not to make any jokes, not to drink any wine, which was why I carefully placed it back there so no one can see it, and to just be strictly business. So that's what we're going to try to do. I suspect it will last at least 2-3 minutes. And so let me introduce our panelists. There will be brief introductions, in interest of time so that we can get to the conversation. Our format is going to be, I'll ask a series of questions. It may be for all of them, it may be for one or two of them. They don't know, I don't know, nobody knows, God knows. And after that, we'll probably open it up to questions from the audience, if that's okay with you all. Again, good to see you all, and thank you for being here. Our panelists will start with Dr. LaTanya Riddle-Jones, representing the Cranbrook Schools, class of 1997. She is an assistant professor at Wayne State University, medical director for the Corktown Health Center, Associate Medical Director for the Tri-County Breast and Cervical Cancer Control Program, and Faculty Mentor for Fit Kids 360 at Wayne School of Medicine. Representing University Liggett class of 1994, we have Dr. Bob Rabani, Program Director for the Cardiology Fellowship Program, Associate Professor at Michigan State University and Wayne State University, and Senior Staff Cardiologist at Henry Ford Hospital. Representing the Roper School, class of 1990, we have Dr. Adam Dorfman, Professor of the Department of Pediatrics, Director of Non-Invasive Imaging and the Division of Pediatric Cardiology at Michigan Medicine. And lastly, and certainly not least, representing Detroit Country Day class of 2006, we have Dr. Samir Bhagwan, who is a primary care physician in the community of Wyandotte, Michigan, practicing both inpatient and outpatient care for a lower health literacy population, what I might describe as doing God's work. So let's give all of our panelists a round of applause. The next round of applause, lady and gentlemen, is you'll have to earn. So let's get started. These questions, by the way, were developed by a group of you all, a group of panelists, and they're really great questions, and any one of them we could spend a fair amount of time talking about, which we don't have the time to do. So we'll get through them reasonably quickly, but just thank you to the panelists for making my job so much more, to the people who formulated the questions for making my job so much easier. So the first question, and we'll start with you, Dr. Riddle-Jones, is how did the independent school, these 4 schools you attended, prepare you for your current role?
Okay, so going to Cranbrook made undergraduate education simple, at least the first 2 years, not the whole time. The first 2 years. I studied engineering at Michigan State University. My first 2 years, people were coming to me for their advice on how to adjust to living in college and how to adjust to the workload, right? The workload at the independent schools that we go to, that really felt like college. And the diversity that we experienced on our campuses with international students or students from various socioeconomic backgrounds, I mean, that just was a microcosm of what was to come in college. So I felt like a mentor as a freshman in college. So I just felt very prepared. I got my GPA set. I had a 3.9 in engineering my freshman year. And so a lot of my friends who went to other schools for high school, they couldn't say that. So I was very well prepared going to Cranbrook.
I think this is a great question for each one of the panelists. So, you, Samir?
Sure, yeah. Yeah, I have to agree, kind of add on to that. I felt like well prepared, not just for, maybe over prepared for college, but I kind of almost compare it to med school in a way, in terms of how busy I was in med school and even in college, in high school at Country Day. We had, at Country Day, we were required to have, be part of some clubs as well as a sports requirement. And I was in band for 4 years. I played football for 4 years. And I'm not sure if I would have done that if had those not been required. And so having to juggle all those responsibilities definitely, put me into, to help me develop that skill set and time management to be, best prepared for life in general.
Yeah, first of all, thank you all for having us. I think this is a really great event, and I'm just really honored to be here and be in this audience with all of you. Just looking back, I look back so fondly on, I was a lifer at Liggett all the way from kindergarten through 12th grade, and I can tell you that what I would add to the conversation is I think each school, has its own fantastic qualities. Wherever you went to school for high school and what have you. And for me, I think it was really the love of learning. I think that's really what I brought with me from my experience, and then through college, and then and beyond, is just that's the sense of awe and wonder, and just wanting to understand the world around me. And I think the teachers that I had, and thinking back all the way through my entire experience there to when I graduated, what everybody contributed to, to my growth, I'm so grateful, and I just kind of think about how can I give that back, every day. So that's really what I took with me from my experience.
Yeah, that's great. I would certainly echo my colleagues. I mean, both in terms of being academically prepared and the love of learning point is crucial. I mean, that's what medicine is. I'm an old guy, and I'm still seeing stuff that I've never seen before, even in a pretty little niche field, which is an incredible thing. The other thing I would add is, Roper in particular, and I, like Bob was at Liggett, I was 12 years at Roper. A lot of what it's about and what the philosophy is about is this respect for individuals, for understanding each different person as who they are, and really just appreciating that. And when I think now about what I do every day and about how I relate to my patients and my patient families, I think the core of that really truly comes from all the time that I spent just being infused with that philosophy or Roper.
And the love of learning that you all are talking about, I feel like we learned how to think.
Yeah.
And that's a skill that I don't see in general with everyone that I interact with. So I think that was a key skill to learn at these schools.
Absolutely.
Great. Thank you. My family history is my dad was a surgeon, an immigrant from Jamaica, came to the States to go to medical school. And I'm told that, from the time I was 2 years old, I wanted to be a doctor. I don't have any way to confirm that or not, but that was the widespread family history and expectation. It was just my lifelong dream. So I don't know that high school necessarily influenced that decision necessarily, but my question for you all is, what did influence that decision to become physicians? Did the high school or earlier, plant that seed? Was it already there? Did it nurture that dream? Or what's your story in terms of how you ended up as physicians? Dr. Dorfman, why don't we start with you?
All right. So like Dr. Gray, I think I knew I was going to be a physician from a very young age. I think the earliest thing that I actually remember was that I came down, here up the street to get a CT when I was like 6 years old. And the whole team came in with the med students and everything else. And I really remember my dad talking about how, oh, that's the third-year med student, and they do all the scut work and all this stuff. And my thought at the time was like, okay, so, at some point that's going to be me. So going to high school isn't what really impacted on that. But I think that just the sense of service and community that I got at Roper certainly, pushed me in terms of making decisions about where in medicine to go, that I wanted to go into pediatrics from really pretty early in my medical training. I think a lot of that came from just the kind of sense of community and how I wanted to be able to serve.
So, I grew up in a medical family. I think Dr. Gray knows that my father was a pediatrician for many years and was at Children's in the 60s.
Your dad was a legend.
So I grew up in a medical family, both my parents and my extended family. So I kind of was exposed at an early age, and I think that's probably where it started. That's where the seed was planted. But I didn't know until later in college. But I can tell you, just thinking back at through my high school and through my middle school years at Liggett, I can tell you though that the experiences that I had specifically in the sciences really kind of kept me on that track. I mean, it definitely kept me loving that particular field. And I think it was later on that I sort of developed my final decision. But even, just thinking back, if I just think about specific experiences, is just thinking in middle school and sixth grade, science with Mrs. Renaud and talking about trees and talking about leaves and just every fall, I think about my science classes in middle school. And so I think just that those experiences stay with you for the rest of your life. And that's, that was I was very thankful to have had that.
Adding on, it's like for myself, I also knew I wanted to be in medicine or be a doctor when I was in probably middle school, before I went to Country Day. And then I went to Country Day in 8th grade and throughout high school. And while there, I could name probably most of my science teachers, Dr. Fazio, Ms. Winter, and Mr. Fisher, and how they were, they're all so passionate about what they do. And that really, helps foster, your curiosity as well, even further. But I'd say the other big memorable thing for me at Country Day was we were all required to do a senior project, and which is essentially kind of like a mini internship for a few weeks at the end of your senior year. And Country Day allowed me to, instead of follow somebody, I just enrolled in OCC's EMT basic course, like their accelerated course, and did that for 6 weeks. And then graduated high school, graduated from the course, and was an EMT basic for that summer before college.
Wow.
And that was my real first experience in like true patient care. And it was a real formative experience for me, and then kind of really helped me know more that I really wanted to be a doctor.
That is so cool. I knew when I was about 5 or 6 years old, my brother, my younger brother, had asthma. He had to be airlifted to University of Michigan Hospital. And I remember being in the ICU and on the floors, meeting a patient, having an experience with a young little girl with cancer, but then also seeing the short white coats. And I remember seeing one Black female medical student, and that just really excited me. Fast forward to senior year at Cranbrook, we had a senior May project, which is kind of like an internship. It's 3 weeks towards the end of your school year. You get to end your senior year a little bit early if your grades are good enough. And I was able to spend that 3 weeks with a Black female internist at Detroit Sinai Grace Hospital. And I knew that I wanted to be a physician at that time. Now, she was an internist. I was totally pediatrics or emergency medicine because the TV show ER was popular. But the exposure I had to internal medicine, I later went into dual med peds. So that was incredible. And then the science courses you're mentioning, Mr. Connor had an anatomy course at Cranbrook, and we had dissection, I guess, at that time. And so my son is at Cranbrook now, and he sent me a photograph of his fetal pig that he's dissecting. So, the school did influence it. Maybe not the first influence, but definitely solidified the desire to go into medicine.
Nothing better than a picture of a fetal. Yep. I wish that our jobs were really like the ER show, or better yet, Grey's Anatomy. I really miss that part. So we have here a pediatric cardiologist, an adult cardiologist, a primary care internist, and a primary care med-peds doctor. How did you make that decision? What influenced you to do what you're doing today? Why don't we start with you, Dr. Bhagwan?
I really love teaching. I love answering questions and helping inform people, and I think I learned that that's a lot of what primary care is. Doctor in Latin actually means teacher, and so I kind of took that to heart, and that's kind of really what gravitated me towards primary care. And then I was lucky enough to have married kind of into a primary care practice where my father-in-law was a primary care doctor, and was able to join his practice. I'm not sure if it wasn't for him, I might be stuck being a hospitalist. Not that that's a bad thing. No. It's just not. Just
All
not
the hospitalists in the room, you can talk to.
Right.
But I think, outpatient primary care was kind of more up my sleeve because of that reason. Yeah.
Dr. Rabani.
Well, for me, I didn't know until later in my training, but I did love. First of all, with the first decision we all make is, do we go more towards a medical field or a surgical field? And I learned that I love taking care of the whole person, and I think that internal medicine really called to me. And so I pursued that. And then during my internal medicine residency, I also had some great experiences in the field of cardiology, just seeing the breadth of things that you could do from all the way from prevention to intervention. And that kind of really appealed to me, that you could still be an internist, you can still take care of the whole patient, but then also be able to be involved in the diagnosis on so many different levels, and then treatment all the way up until heart transplant. And that was so unique and thrilling, and how the field, it's constantly changing, and how much you could contribute back to society. And I think those are some of the things that drew me into this field. But every field has such wonderful qualities.
That's what makes the decision hard sometimes.
Yeah.
Dr. Dorfman.
So I guess I'll preface this by saying that I really love what I do. I just managed to make those right choices down the road. And the first choice is, of course, as Bob just mentioned, medicine versus surgery. And for me, that was very clear. Like, my first clinical rotations were in surgery, and then you start doing that, and you hadn't done it and been in the classroom, because back then we did 2 full years of just being in the classroom in med school. So it's like, oh, this is so cool. And then kind of take a step back and say, wait, why do I like this? And, realize that that's not that, and being an OR is not what I want to spend my life doing. But then the next one is really important, as adults or kids, or I guess Dr. Bill Jones would say both. But for me, similarly, there are a lot of reasons why I chose to do pediatrics. It's this daily enormous dose of just hope and love, and it's an incredible thing. And at the end of the day, you see this 2-year-old toddling down the hallway with their diaper hanging out of their hospital gown, and I really prefer that to seeing a 82-year-old toddling. And so pediatric cardiology is this incredible field because it offers everything. It's a mix of, I deeply, probably more than anything, value my long-term relationships with families, and we get plenty of that, but also there's the acute and critical care, and being in there, I'm a non-invasive doctor, but it does mean that I'm in the OR, taking pictures post-op and telling the surgeons if they need to do more and stuff like that, and being in that situation that I really enjoy. And on top of that, all of the technology and all the changes that we're constantly seeing that are really exciting. And I think about, even just over my career, how much more we can do, how much more we can see than we could 15 years ago and 20 years ago. And then you add being an academic center, where we get this new, fresh infusion of 6 new categorical pediatric cardiology fellows every year, who are bright-eyed and excited and ready to learn and enthusiastic. And it's a whole new way of looking at it, again, every single year. And it just keeps it so fresh and exciting that it's just fantastic.
Okay, so I guess I'm next. So I'm med peds, which means I am just really indecisive. I liked everything. The only thing that I did not like was obstetrics and gynecology. I did not want to deliver babies. So that kind of took away the choice of family medicine. I also thought I was going to go into subspecialty, but once I did my residency, I realized I loved everything. But what I didn't appreciate was the pathology or the severity of illness with my patients who were in the hospital. So I wanted to focus on preventative health care. And so that's kind of how I ended up with ambulatory med peds. Yeah.
Great. I don't know if it was the fainting in the operating room or the fact that I so strongly dislike surgeons. But I'm just telling it like it is. I like surgeons now, especially like surgeons when I was the hospital president. But some of you just think about it for a few minutes. Where does the money come from in hospitals? Anyway, I suspect that that probably did in my, the likelihood of my surgical career. But U Hospital, the University Hospital in Ann Arbor, at the time that I was a medical student, was the old University Hospital, and it was the hospital was like a scene out of a Dickens novel. It was gray, it was depressing, it was old, it was all wards with just curtains in between the beds. It was like, and it had it smelled. I mean, it was just like really. It just wasn't very attractive, and the Mott Children's had just been built a year before, and so it was like the difference between the first part of the Wizard of Oz and the second part of the Wizard of Oz. And I was really attracted to all these little munchkins running around, singing, happy as can be, even with the god-awful prognoses and diagnoses that they had. They're just like really, you nailed it, Dr. Dorfman, hopeful and loving, and it's just like magic. And it called to me, and I was done. My father had told me the only good doctor is one who knows how to cut. I completely, totally ignored that awful advice, and it's been great ever since for me. But thank you for those answers. This one is, I suppose, a reflective question, and that is, what would you tell yourself as a first-year medical student? What would you tell your first-year medical student self? Why don't we start with you, Dr. Rabbani?
So I think just thinking back on those years, I think that perhaps one of the largest, and many of you are, some of you are medical students, or yes, medical students, and are college students, or some college students in the audience too, and I think every experience, every new experience has a learning curve. Starting from when you walk into freshman year in college, first year in medical school, when you start your residency, when you start your new job, you start your new position. But perhaps one of the largest learning curves is your first year in medical school. I mean, that is just the exponential. And I think just looking back, it really was drinking from a fire hose in terms of the amount of information and the amount of memorization that happened in that year. And I'm sure all of those of us who've been through it, I mean, we've experienced a lot of ups and downs and highs and lows and some great, wonderful experiences and some more challenging experiences. And just I would tell myself to look, just, think about why you're doing what you're doing, and keep that in perspective. And whatever stage that you're in, is that why you originally chose to follow this path. And I think about that today too, every day, and keep your head high and really enjoy the wins and learn from those times where you potentially have a little setback, or that it's a little bit more challenging. And it's easy to look back and think about that, but when you're in the thick of it, sometimes it can be hard to realize that. But in the end, this is just as you all have been saying, is a magical profession. And what we are entrusted probably with, we are entrusted with people's lives. Honestly, we're entrusted with the most sacred information and most sacred care of human beings. And it's an honor and it's a privilege to be able to do that and to have that responsibility. And the impact that you make on patients' lives is just, it's more than you'll ever imagine. And also, if those of you who are teachers and, professors and who give back and have residents and medical students and fellows, I'm a training program director. That is also another aspect of things that, you impact the lives of so many more patients and so many more practitioners through the people that you teach and that you mentor. And just to keep that in mind about the years ahead and the great things ahead of you.
Dr. Dorfman?
Yeah, I was thinking about this. It was a long time ago, and a lot has changed. One thing that's a little bit challenging going through medical training, and it has changed, but there is a lot of conflict and a lot of learning about conflict resolution, conflict management, how to work through things with people. People don't quite treat med students and residents now the way that they did 20 years ago, fortunately. But there is a lot to go through, and I think being in more of a leadership position, something I've been thinking about a lot over the last few years and really trying to preach is to assume good intentions. So, people are often coming at things from different directions, have different thoughts, different ideas. And it's easy when you're in an intense situation, and dealing with critically ill children is an intense situation. There's nothing more intense to kind of get going up at each other and all that stuff. But if you really stop and realize that it's essentially always true that this other person with a different view is coming at it just like you are. They're coming at it trying to help, trying to solve a problem, coming at it with the best intentions, even if you think their idea is terrible. It makes it a lot easier to kind of come to an agreement or come to the middle and take some of the noise away. I certainly going through medical training, and I've also probably calmed a little bit over the years, but I think that certainly had my share of conflicts and things like that. And I think understanding that from a younger age would have been pretty helpful.
LaTanya?
I would tell myself that you are going to successfully finish. You need to ask for help early, not be ashamed when you need some help, because other people who've made it have had struggles too. And you will eventually get to spend time with your family again, but you're going to take a little break right now, and it'll be worth it. That's what I would tell my intern or my freshman first year. Oh, yep.
I guess one thing that I would emphasize is that grades don't matter. I doubt that any of you remember what you got on your first or second biochem exam or whatever exam it was in med school in the first year. And so, for me, it's either spending time memorizing, the rote memorizing, whatever fine details are on the exam, or spending time, trying to understand the material. And then, you can spend time memorizing as well, because you do need to memorize for some of those exams. But if you can spend a little bit more time, and, even if you get a B instead of an A, but spending more time understanding the material and the basics of the material, then that'll go much farther in building your foundation for what you will then learn, in clinicals and rotations, and then further on in medicine, because it's a never-ending learning process. And I'm thankful that I was there for some of the material, and still remember understanding some of those things. But then I have to kind of go back now and go back and read a lot of things that I definitely learned before that I definitely don't know now. So just not worrying about grades. And thankfully, I think once you hit med school, that's a time period where it doesn't really matter after that point.
So who remembers their first biochemistry test reading? You really remember that?
Not my score. That's what I'm saying.
Oh, not your score.
I don't remember the
Oh,
test.
okay.
You're right.
No.
I tried to repress as much as possible. It's like, oh my God. If you say the words Krebs cycle to me today, I'll just melt into a little lump.
But it comes back around. I had to relearn it for my son's AP Bio class.
That's what you get for having smart kids. I understand that part of the goal for tonight, besides this wonderful panel, is to just have networking opportunities. And so this next question is a networking question. And it's always, besides a medical degree. I have a master's in business administration, and business folks. I mean, they just love networking. And believe it or not, I'm an introvert, and sometimes don't really like people all that much. But another story. I just break out in a rash when I hear the word networking. So thank you for this question, Mackenzie. But the question is really, they say it much more eloquently, but basically, is networking important in your professional lives? So Dr. Riddle Jones.
Emphatically, yes. And it has to start as soon as possible. The reason that I think I got to this point was I started interacting with the Student National Medical Association, which is the resident and student chapter or organization under the National Medical Association. I did that as a freshman in college. So any student that I interact with who is pre-med, who is of an underrepresented background, I tell them, find your local school chapter of MAPS, which is the Minority Association of Pre-College Students, so the pre-meds, and go to the national conference. So, and even as I guess I'm mid-level now, I'm kind of old. Mid-level faculty. Okay.
Yeah,
Dr.
right.
Gray, sorry. It is so important to go to your national conferences and to meet people there. And I do a lot of research, I do a lot of teaching, and that's where I meet people and I collaborate with them and publish papers. So for my academic career, it's very, very, very important.
Great. Dr. Bhagwan.
Yeah, I mean, absolutely. It's important. But for me, how it's useful for me is, in primary care, there's a lot of questions that I have when I'm seeing patients, and I wish I could come back to the patient maybe the next day with some of those answers. But it's helpful to have consultants on speed dial or be able to text them and try to get answers and try to maybe do workups for patients before they see consultants before I refer them. So it's very helpful for me in that way to kind of have a whole array of specialists at my disposal, I guess. And the way that I do that is by just reaching out to everybody that I refer to and trying to talk to them about our patients and our mutual patients, and then even trying to collaborate or trying to touch base with them outside of medicine just helps kind of build that relationship further.
Dr. Rabani?
Yeah, so I think the way I sort of think about it would be each stage is still different. So each stage of life that you're in, or your environment, networking takes on sort of a different meaning or a different purpose. I think in the medical school years, it's so important to, I remember thinking back all the interest groups that I was in at Wayne State and what have you, and meeting potentially future, attendings at residency programs that you'll be at, or getting involved in research, or just really kind of learning about the different fields and learning about, kind of what you love about medicine and what you love about that particular field. I think as I sort of moved on and kind of become, progressing in your career, I mean, networking can have so many other great beneficial, reasons to do it. And I think for me, it's lifelong learning. It's really, getting involved in your professional and educational community. So as you all were mentioning, just being involved in your professional societies, you can build programs that way. So oftentimes when you're in your own particular work setting, you might not have the opportunities necessarily that you want. So, that you really want to kind of break out of your box a little bit, and you want to try something new, you want to contribute, you want to kind of grow a certain field or a certain interest of yours. Look to your professional communities. I mean, that's where you can do those sorts of things and really kind of contribute, be involved in committees, really donate your time, be enthusiastic about donating your time. I think in so many ways that helps you, that helps, who knows, it might lead to a future job or a future, opportunity for you, but it also allows you to grow professionally. So I think at this stage, that's kind of how networking really has helped me, but events like this is wonderful. We all get to meet and talk and kind of share our experiences, and we all went to some fantastic schools that we have such fond memories of. And just to talk, I was at my 25th college reunion recently, and that was a transformational event. And so really, I love having opportunities like this to be with like-minded people and sharing our experiences. So.
Notice how the 25th reunion, everyone else looks much older than me. Weirdest thing. I think a few different things about networking, because these were all really great points. So I'll kind of take the tact of coming from sort of a small academic community, in a field that's really, there's only a few thousand pediatric cardiologists in the country. So a few things that are really important about networking. One is research. So you see these adult cardiology papers in the New England Journal, and they have 20,000 patients with coronary artery disease or whatever. And then if I see a pediatric cardiology paper that has 200, it's like, wow, that's pretty good. There's just so few patients. And so to be able to pool our patients and work together, it's been a huge change really over my career in how people do research. It's all multi-center research. And med schools have recognized that. And so now they put much more weight on being middle authors that they didn't used to care about, because they recognize that that's how the work gets done. So having those connections around the country and the people to work with is really important. Second one is, as a mentor, having the connections around the country is really important. So our senior imaging fellow this year, she and her husband desperately want to get back to the Research Triangle area in North Carolina, where both of their families are. And so she came in and told me that. And I called my friend who's the Echo Lab director at Duke, and it all worked out, and she got her job offer last week. And it doesn't always work out that way, but having those connections is really important for mentoring and for helping the fellows in that next generation. And the third is that it's really fun. And every year when I go to the American Society of Echo meeting, the Society of Cardiac MR meeting, it's really like a family reunion. And just seeing everybody and going out and connecting, and it's just brings a lot of, it's just fun. And so we really enjoy that piece of it above the more kind of concrete parts that it brings.
So you pointed out, Dr. Dorfman, a real-world example of the power of mentorship. I'm curious if any of you all have either personal stories or testimony in terms of the value of mentor, either from the perspective as a mentee or mentor.
Shall I? Go for it. Okay. Well, I can say from the side of being a mentor that every year I'm as a training program director, we select a new fellowship class every year, and we have. I've been doing this long enough now that I now have multiple generations of medical students that that I've had the pleasure of working with, and just to see that the relationship, that mentorship relationship that you had as a attending with a medical student and who's now applying to your program, and now you've accepted them to your training program and are now being able to mentor them on a completely different level. That's one of the greatest joys that you can have. That's one of the greatest joys that I've ever experienced. So there's so much value to that. And then, or also potentially bringing folks who might not have even thought about your field into your field because they looked up to what you were doing. I think that just is one of the joys of what we do.
Anyone else?
The other type of, it's maybe a little bit unique to being in pediatrics, but I have a patient who we did surgery for her when she was, let's see, I remember we all played Tooth Fairy, so she must have been she was like 7 or 8 because she had to have a tooth pulled by anesthesia before they intubated her. And she's still my patient, and she asked me to mentor her for her senior high school projects, which she did about essentially her heart disease. And she's now a U of M nursing student, who still comes and sees me yearly. And as a mentor, seeing that whole change from this little post-op girl to where she's entering the healthcare field. She even did a clinical rotation on our pediatric cardiology ward. It's incredibly rewarding to be the mentor. It's just, again, it's kind of always something different and fresh, and this chance to impact it for younger people. On the other side, I feel like I owe an incalculable amount to my main mentors from when I was a fellow. They're the people who, just taught me and dealt with me being grumpy and tired and being beat on a little bit and everything else. But also then helped me to get my foot in the door, gave me that first talk on the podium at a meeting so that people could see who I was, introduced me to, we talked about all this networking and everything, to the people from around the country, and kind of brought me into that community. And so I owe them so much, but I also now recognize how much they get from seeing me mentoring and doing these things, and that I get to enjoy now on the other side.
Being a mentee, your mentors really can be your sponsors in the room when you're not there. And so that has been very rewarding for me, finding out that there are people who really believe in you. And even when you're not there, they are going to be telling the story of how amazing you are. And then with our trainees, I always tell them, you don't just have one mentor. You have many mentors for all areas of your life, whether it be your professional life, your subspecialty, being a mom in medicine. You have to have mentors to help you with all aspects. So being a mentee has been rewarding. And then now being able to have some expertise and actually mentor some of my mentors. So it keeps giving.
Great. Sanford Cohen was the chairman of the Department of Pediatrics when I was a second-year resident through my fourth year as a chief resident. And they had a process of sometime during the second year of that class, the chair would identify who the candidates were to do an additional year, which at the time I thought was like punishment, not a reward. So there were 6 or 7 people in my little group of 20 residents that were chosen as potential candidates. And the guy that never wore a tie to work, or always looked like he was just fell out of bed, was suddenly wearing suits and sport coats to work every day, and people were eagerly answering questions about the most esoteric sort of stuff. I went into Dr. Cohen's office shortly after he announced I was one of these people, and asked him why, because I couldn't understand it at all. And he said, "I see something in you that you don't see." And it was really, I've had a lot of transformative, I think, experiences in my life, but that was certainly one of them at a professional level. Was somebody saw me as a leader that I had no interest in being a leader. I had no really perspective that I could be a leader. My goal was pretty simple. I just wanted to be the best pediatrician I could be, and I was going to sit on the porch when I retired, and all these generations of children would come and tell me how wonderful I had been. It was a very simple but fabulous aspiration. And this guy completely turned my world upside down in terms of where I thought I was going to be and what I was going to do. Mentors are incredibly important. And I think you get as much out of it, having mentored lots and lots of young people over the years now. I think you get as much out of it as you sometimes get from it, or as you give, I should say. We have just a few minutes left. A couple more questions, maybe. We'll see how good your futuristic talents are predicting what healthcare is going to look like in the future. And anybody can answer at any time, but having no one answer is not acceptable. In your opinion, what are some exciting recent advances in medicine that will shape our lives and our futures? Easy question.
So there's the kind of hot words that we can all throw out, AI. But the reality is that that's actually, well, that's the low-hanging fruit answer to this question. It's very real, and it might be the biggest challenge that we face, and it might be the biggest opportunity, or probably it's both. So thinking about some of the stuff going on right now in cardiology, and especially on the imaging side, there's a lot of AI being used now every day to make things faster, to improve productivity. So the computer looks at the heart and decides what the ejection fraction is, and it works a little better in the adult world than in the pediatric world, but a lot of that stuff's done. Now, we're also left with this number and not really understanding how it was generated, and still have to kind of decide whether we believe it and what to do with that. And so there's challenges around that. So there's kind of the technology side and how it's going to change things. And there's lots of like stuff in the popular press about AI recognizing small cancers on mammograms faster than radiologists in some cases and things like that. But it's be interesting to see how that goes. But the second side is a different type of productivity question, which is there's a lot of work going on with EPIC, which most of us in hospitals deal with, is our electronic medical record. So one of the things that's just being talked about at Michigan is, holding back, they're working on a new thing that basically will listen to a patient visit in clinic and write the note. And again, it's a challenge and an opportunity, like save a lot of time, but then is everybody going to take the time to really go through and make sure that it's faithfully reproducing what it's supposed to be and what that means? And there's going to be some bumps along the road with that for sure. And the third thing I'll say about it is that it's kind of garbage in, garbage out. And so if AI is trained with biased data, whether there's bias can mean a lot of different things, but I'm really thinking about ethnic and racial bias, then that's what it's going to spit out. So one example is that the first papers were from some U of M researchers figured out that pulse oximetry gives less accurate data in darker skinned people. And nobody ever knew that. And in fact, I just had to do the online redo of my PALS certification from the AHA, from the American Heart Association, and there's a page about pulse oximetry, and it said in bold, patient skin tone does not affect results of pulse oximetry. And they have a little like, tell us if we're wrong that I hit, but so if there's, AI models being built to recognize, impending doom in patients in the ICU or something that are based on faulty biased data like that, then that's exactly the result that we're going to get. And so how to build these systems in a way that they're going to help lead to more health care equity and not less, how to treat people and get people the same types of results no matter who they are. It's going to be a huge challenge.
So you mentioned computers looking at biopsy slides or radiologic images. Would you counsel your son or daughter to not be a radiologist if they're going into the field today, or pathologist?
It's an interesting question. So for the record, neither of my sons have any interest in going to medicine. I do think that there are real challenges on the radiology side, and doing congenital cardiac MRI is a little bit complicated politically and different everywhere, but so I work side by side with radiologists all the time, and I think they do feel that pressure a little bit. I think that I do have some concerns. There's always going to be some of the more niche-y stuff that you're going to need humans for, I think. But some of these things like mammography is probably a good example. I could see it becoming really predominantly done by the computer.
Anyone else want to weigh in on the future?
I will. You mentioned health equity. So health equity is huge right now, whether it be social justice or environmental health justice. We are seeing that the effects of systemic racism, it affects every aspect of life, especially health disparities. And so now we finally have groups of people working together. I'm one of those people working to take out the race coefficients in clinical algorithms because they were created out of nowhere. They actually don't make any sense if you learn the history of medicine. So learning the history of medicine is actually going to propel us forward exponentially. Learning why the air quality in a certain neighborhood is so poor, and then realizing it's because of redlining policies that were put in place for that particular reason. So health equity, I think, is huge in the future of healthcare.
Well, those of you who work at these incredible schools, I think you have pretty good evidence sitting there at that table of the remarkable job that has been done in you all's education and in next generation and the next generation and the next generation. It's been a pleasure for me to be here. I have enough questions to do this for another 5-6 hours. Looking at the audience, I'm pretty sure that wouldn't be really enthusiastically met. You all did a fabulous job, and I would just ask the audience to join me in congratulating them.